So this discussion is going to focus on some of the important concepts just related to muscle activity and strength. So when we look at muscle activation, so we're essentially here going to be looking at the different types of contractions, activities that the muscles can actually take part in. So first we have an isometric contraction. So that's when the muscle force, the muscles produce force, but there's no appreciable change in muscle length. So in other words, you're getting the muscle to produce force, but there's no change in length. Usually this will happen with a resistance that you can't move. Okay? So for instance, if you just went and pushed your arms into the wall, you can get a maximum contraction of your muscles, but you're obviously not going to push the wall. Your muscles are going to stay statically contracting. The concentric contraction is the shortening contraction, or we commonly see when you're referring to resistance exercise, the lifting phase. So the lifting phase involves the muscle shortening and producing a contraction in that fashion. The eccentric contraction is the lengthening contraction. Okay, so when you're in what we commonly think of as the lowering phase of a lift. Okay. So when you're examining the muscle activity, for instance, in a basic strength movement, you have to understand there's going to be concentric contraction of the prime movers and an eccentric contraction of the prime movers. The prime movers are going to be the same for each phase. It's just that in one phase they're going to be shortening, and in the other phase they're going to be eccentrically lengthening. You have what's called an isotonic contraction. Now, an isotonic contraction, and this can be a little confusing sometimes with the way it gets used. Isotonic refers to what we call equal tension, okay? So essentially, isotonic contractions in a technical sense don't happen a whole lot in real life. In order to have a pure isotonic contraction, you have to have specialized equipment in order to do that, because the tension is to be equal throughout. So in other words, if you just go and pick up a dumbbell and do a dumbbell curl, some people would say that's an isotonic contraction because the joint's moving through the range of motion. However, as we've kind of talked about already, and we're going to talk about again, the tension in the muscle doesn't stay the same throughout the range of motion. Okay, there's actually a change in the tension. So when you curl a dumbbell or do any exercise for that matter, the tension does change. So there is a lengthening and a shortening that takes place with an isotonic contraction, but in order to get a pure isotonic contraction, you technically have to have equal tension throughout the movement, which, as we see with free weights, doesn't always happen. However, don't be surprised if you see this term get associated with free weights. And then you have isokinetic. And isokinetic means that the rate of movement is constant. So in other words, the speed at which you're moving stays constant. So again, this is another type of exercise that requires a special isokinetic device. You commonly see these in rehabilitation facilities. You might see them in performance facilities, big high-tech performance facilities. So they don't get used a whole lot. Basically, what an isokinetic exercise does is it keeps the speed of motion the same. So when you use an isokinetic, this is a form of what we call accommodating resistance. If you look at figure 4.2 in your textbook, they actually show you a picture of an isokinetic machine. So for instance, if you did an isokinetic knee extension, what you'd be doing is setting the rate limiting device at a degrees per second. So you don't set a weight, in other words. You actually set how fast the person's going to be able to move the machine. And no matter how hard they push, they're only going to be able to move at that speed. So in other words, the harder the individual would push to do the knee extension, in the case of seated knee extension in this example, the machine's actually going to push back harder, so it's going to accommodate for that resistance to keep them moving at that speed. So say you only want them to move at 120 degrees per second of knee extension, that's only as fast as they're going to be able to move it. The harder they push into the machine, the harder the machine's going to push back to limit that speed. The key with this is that the person does have to push as hard as possible to get the most out of it. Okay, so if they sort of, take it too easy and don't push as hard as they can, they're not going to get out of the exercise what they will. So again, you're kind of limited by that, and you're also obviously limited by the availability of that type of machine. We talk about functional activity of the muscles. Okay, you have your agonist. Your agonist is the muscle that's the principal muscle producing movement, okay? Or in the case of posture, maintaining posture, okay? So the agonist contracts to produce either concentric, eccentric, or isometric, just depending upon what it is. So an agonist muscle could be producing an eccentric contraction, okay? If that's the case. For instance, if you're talking the lowering phase of a squat, the agonist at the hip in the lowering phase would be the hamstrings working eccentrically, okay? The antagonist is the muscle or group that provides the opposite motion, okay? And in many instances, the antagonist is going to need to relax, particularly when we're talking, for instance, a concentric activity. So, for instance, if we go back and look at, again, just to compare this in a practical exercise, if you go to do a tricep press down, okay, the agonist is obviously the tricep muscles. The antagonist would be the bicep, okay? So it's either the muscle that's on the opposite side or the muscle that would resist the movement. And when we're doing concentric activities, the key is to get the antagonist muscle needs to relax, okay? If the antagonist doesn't relax, it doesn't create for functional movement. A synergist is a muscle that contracts at the same time as the agonist. So a synergist is basically an assistance muscle, okay? Synergists function to kind of, again, assist and produce stronger, maybe more efficient movement. Synergists aren't necessarily a bad thing. They're actually a good thing. They work with functional activity. However, there is a case where individuals can have what's called synergistic dominance. That's not a good thing. So synergistic dominance is when a synergist kind of takes over as the prime mover because the prime mover is weak. And in a lot of instances, that could actually be a contributor to a persistent pain issue or a chronic injury. Okay, so for instance, if somebody has a weak glute medius, okay, many times they become synergistic dominance where the TFL will become the primary hip abductor. The problem with that is it can cause that to get very tight and can cause some problems with hip abduction, could cause some issues with, going down into the IT band as well. So there's a lot of things that could come out of that. So again, synergists are good when they're working with the agonist to just produce stronger, more efficient movement. If the synergist becomes dominant, then you can end up having some problems. Okay, so when we look at the characteristics of muscle, so we're just looking at some of the physical properties that muscle possesses. So there's 5 different properties to muscle. There's excitability, conductivity, contractility, extensibility, and elasticity. Okay, those are the 5 properties of muscle. Now, if you just think about those names and what their definitions could be. So what is excitability? Well, excitability means that they can be excited. They're stimulated by nerve tissue, okay, to contract and produce activity. Conductivity, it can conduct electrical activity, okay, it can conduct input from the nervous system. Contractility, it could contract, okay. Extensibility, you could lengthen muscles. Elasticity, when you lengthen them, they have the ability to go back to their original length, okay? So it's kind of like a rubber band. A rubber band has elasticity. Now, they're not perfectly elastic because they don't act just like a rubber band because obviously there's other properties there. When we talk about how muscles are going to respond, we have to look at the concepts of stress and strain. Well, first we're going to define what stress is, and we'll look at stress and strain on the next slide. Stress is any force applied to a segment, okay? So when you apply, stress to any tissue, there's going to be a change that takes place, okay? And when we kind of look at how a tissue will respond to stress, we look at, again, three other properties just related to tissue in general. Okay, So this kind of could connect to all different types of connective tissue in the body, but you have viscosity, extensibility, and elasticity, okay? So viscosity is a resistance to an external force. So in other words, if there would be a stress, viscosity is the resistance to that. And I think one of the easiest applications, I would say, to know understanding what viscosity is, if you had a cup of water and a cup of honey, and you tilted both of them over, think of what would happen. The water would just flow out and spill. What would the honey do? It would gradually kind of fall out. That's because the honey possesses greater viscosity than water does. The honey has that resistance to movement. Your tissue has that quality as well, okay? Extensibility and elasticity, we already talked about it as 5 primary properties of muscle. Extensibility is just the ability to stretch. Elasticity is that ability to return to normal length when the stretching ceases. Now, when we look at muscle and connective tissue, what we say is that muscle and connective tissue in the body are viscoelastic. So what does that mean? All the tissues in our body can resist stress. That means they provide viscosity. However, they're also elastic. Okay, so they're viscoelastic. They're not perfectly elastic. Again, they're not like a rubber band or a resistance band where you just stretch them and they go back to their regular length. Okay, they have that ability to potentially even maintain the extensibility based upon how long it's been applied and everything else. So these are the general characteristics. So now we'll look at what we call the stress strain curve and talk about what happens when there's some sort of load applied to muscle tissue. Okay, so here we have the stress strain curve. So we discussed on the previous slide the properties. Now we're going to see how these properties affect the tissue when we actually impart stress on it. So stress is the resistance or force placed on tissue. Strain is the ability to deform. So our tissues all have the ability to deform based upon the stresses placed on it, okay? And the significance of this curve looks at what's going to happen based upon the amount of stress to the tissue, how much stress is applied to the tissue, and again, length will sometimes play a role with that as well, meaning how long the stress is applied to it, okay? So if we look here on this curve, here's the stress, so this is force being applied. Here's strain, here's the deformation. These are the 4 regions: toe region, elastic region, plastic region, and rupture, okay? So if we were to just look at a tissue in the body and apply stress to it, okay? So let's just say we were lengthening it, regardless whether it's a muscle, ligament, whatever. And all the different tissues in the body, bone, ligament, muscle, could all be looked at on this curve. So you have your toe region. So the toe region is where you're just taking the slack out of the tissue. So you're literally just taking the tissue up to the point where you're creating tension. So in most of the tissues in the body, there could be a degree of slack in it. That's just taking the slack out of the tissue. The elastic region, okay, you see the stress increasing slightly, so now we're changing the amount of deformation. So now we're starting to stretch the tissue, if you will, but if we stop the stress before it reaches the elastic limit, the tissue will go back to its normal resting length. Okay, hence the reason why it's called the elastic region. Think about what elasticity is. If you stretch it, it goes back to its regular resting length. If you exceed the elastic limit and continue to go into the plastic region is where you'll now start to get permanent changes, meaning that you've now put enough stress on the tissue, created enough deformation that there will be some permanent changes left to that tissue, okay? So when we're trying to get, like, for instance, we're trying to work on, like, range of motion, flexibility. This is what we're essentially trying to get to, because we want to try to create as many permanent changes to improve that in our body's tissue. Now, if you'll notice, so again, the tissue's only going to be able to take so much stress. You notice you reach this point where you get to what's called necking. okay? Notice what happens there, okay? You get a dip. So we have increased stress, increased strain, but what do we notice once we get to a point? We don't need as much stress to cause strain. So what that means is the tissue's starting to hit a weakening point where we've applied so much stress, now you don't have to apply as much, and that's going to precede tissue failure. So in other words, before tissue failure, you usually have this small region where you're not going to need as much stress to get deformation of the tissue. And then at that point you have failure, and that's basically when you're at tissue rupture, okay? So in other words, there's a limit to how much stress. So like, again, when you think about when you're, when somebody's performing stretching flexibility exercises or a clinician is assisting them with that, or you're doing joint mobilizations, you want to make sure you put enough force, but obviously you don't want to create failure in the tissue. Now there's also the concept of what's called creep. Creep happens when material is continuously loaded for a prolonged period of time. So there's increased strain because of the prolonged loading. So even a low load of stress, but applied over a prolonged period of time, could cause permanent changes and or damage to tissue, okay? So take, for instance, people that sit with poor posture for a long period of time in their lumbar spine. Sitting can contribute to possibly causing, for instance, a herniated disc, okay? It's not because of a one-time injury, but what happens is because of the prolonged nature of the stress, the strain happens. So it doesn't have to be a high load or a lot of stress at one time. If you apply a very low load stress over a prolonged period of time, this could happen. Now, sometimes we do this as a form of treatment, okay? So for instance, sometimes with like traction, splinting, and serial casting, for instance, these are all examples of things where we'll try to get a stress relaxation response to help improve range in a given area, okay? Now, it's important to note when you look at the stress strain curve, depending upon the type of tissue you're talking about, this slope, okay, can actually become steeper. So in other words, if this, say this is representative of muscle, okay, bone will be a lot steeper. So if tissue is a little bit, is more stiff, okay, this slope becomes much steeper because again, because what happens is then you go through these ranges much faster. So in other words, with bone, okay, if you apply stress to a bone, this is going to happen a lot faster because bone is made out of a stiffer material. It's made out of a harder material. So you'll go through this much faster in that instance. So when we look at muscle strength, there are various factors that influence muscle performance. So we're going to look at a couple of those qualities here. So the first thing we look at is the fiber arrangement. If you look at the illustration on the slide here, you see two different types of, you see four different types, but the three of them are kind of subtypes of the one. You basically have what are called fusiform muscles or pennate muscles. So if you look at this, they're showing a strap muscle, which is essentially what we call a fusiform muscle, okay? And in this case, what you're looking at as far as the architecture of it is that in a fusiform muscle, the fascicles are parallel and long throughout the muscle, okay? So you see this with the strap muscle. They're kind of all lined up in this fashion. And in that type of muscle is typically designed for a greater shortening distance, but it's not as well designed for force production. So this is typically more for speed of contraction as opposed to force production. That's as opposed to what we look at over here. We have three different types of this. These are called pennate muscles, okay? And they're just numbered based upon whether there's one, two, or multiple, what we call pennates. So if you look at what's designed here, you notice the tendon, okay? So you don't see the tendon in this picture. That's because it's at the end. So this muscle just has a tendon here and a tendon here at the end. You notice this tendon actually goes into the muscle. The muscle fibers actually come off of it at an angle. So the muscle fibers come off at an oblique angle. The advantage to that is now you get greater force production, okay? However, that's at the expense of speed, okay? So when muscles have more of a fusiform design, they're more designed for speed of contraction because they have a greater shortening distance as opposed to the pennate muscles, which based on their leverages and the fact that they're shorter muscles, they're more designed for force production. You also look at just general fiber arrangement. So again, in a parallel arrangement, there you're again, now here again with a parallel arrangement. So in other words, when the muscle fibers are placed side by side, that's going to increase the width of the muscle. So in other words, that again is going to be more adept at force production. Whereas when they're in series, that's when the muscle fibers are kind of lined up end to end. And typically, again, in that situation, you're looking more at speed of contraction. So if we were to look over here, we could use these same muscles in this example. Here you have a parallel arrangement. So you see these, primarily a parallel arrangement. They're kind of lined up parallel to one another because the fibers are going to run this way. Here you have more of a series arrangement where the muscle fibers are kind of in line with one another. So again, that's going to dictate as well whether a muscle's more adept at for producing force or more adept at speed of contraction. Again, concepts of hypertrophy and atrophy. Hypertrophy is when you increase the size of the muscle. Atrophy is when the muscle decreases in size. So again, when you strength train, things of that nature, your muscle will hypertrophy. You'll get an increase in muscle mass. If for some reason you stop using muscles, they go through what's called disuse atrophy, and the muscle fibers get smaller in size. Okay, also looking at muscle fiber architecture, the number of fibers is a factor that determines the ability to produce force. What that does is increases what we call the muscle cross-section. Okay, so again, the cross-section of the muscle, the more muscle fibers that are going to be there, particularly if they are lined up parallel to one another, you're going to have an increase in the muscle cross-section size. Now, it's also important to note that muscle has passive components to it as well. So you don't only have contractile components. So the muscles have a contractile component or an active component and what we call a passive component, basically the soft tissue. So if we look at this, one of the passive constraints that muscle has is what's called fascia. Remember, fascia is that tissue covering that covers and kind of envelops all the tissue in the body. I liken it to saran wrap, okay? So think of it as the saran wrap of the body. And then within the muscle, you have two components. You have what's called the parallel elastic component and the series elastic component. So the parallel elastic component is the force exerted by a relaxed muscle when it's stretched beyond its resting length. So when you stretch passively a muscle, you eventually reach a point where it's going to stop, okay? And at that point is where the parallel elastic component is actually producing tension, okay? So that's the part of the muscle that only produces tension when a muscle is stretched beyond its resting length. Okay, and then you have the series elastic component, which, one of the primary components of that is the tendon, and that's where energy gets stored in an actively contracted muscle. Okay, and a good example of where the series elastic component really becomes activated is when you're doing plyometric. So if you think of plyometric jumping, when you go to jump, you lower yourself into a jump into the bottom portion really fast and then try to jump. What you're actually trying to do is utilize that series elastic component. When you go and you get that quick eccentric contraction to lower yourself, you're actually storing energy in this series elastic component. You say, why is it called the series elastic component? Well, because it's in series with the contractile component. Okay, the parallel elastic component is just that, it's parallel to it. Okay, so here's the parallel elastic component representative of a muscle. So you see over here, here's a muscle. They're showing you the parallel elastic, the contractile component, and the series elastic component. Okay, so the contractile component is where the myosin and actin slide over one another, okay, in the muscle. The series elastic component are the structures in series with that, okay, and the tendon's a big component of that. And then the parallel elastic component is the other non-contractile soft tissue in the body, okay? So just to kind of sum this up, the biggest difference between the parallel and the series, the parallel is only going to resist or produce tension when a relaxed muscle is stretched beyond its resting length. The series elastic component is for storing energy in an actively contracted muscle. So another thing we have to look at are what are called length-tension relationships. And we have to look at the difference between when we're talking passive movement versus active movement. So length, the relationship between length and tension, if we look at passive movement, okay, so here as you know, passive tension, if you just think of stretching a muscle, okay, once you've reached the 100% of the muscle's resting length, the passive tension is going to increase. So that one's pretty easy, okay? If you lengthen a muscle, you get to its 100% of its resting length, now you're going to get passive tension. It gets a little more difficult when you're talking active contraction, but again, if you think about what goes on with this, it should make sense, okay? So as a muscle shortens, okay, as a muscle shortens, there's fewer cross bridges available. That basically means that you're going to lose tension, okay? So really, active tension can be at its highest when muscle's at 100% of its resting length, okay? If you go below that, okay, you're going to lose it. If you go above it and you take the lengthening beyond the 100%, now what's going to happen is you're going to move the actin and myosin so far apart from each other, it's going to limit how much tension can occur, okay? So again, the greatest amount of tension, active tension a muscle could produce is right at about 100% of its resting length. Shorter than that, you're going to use up the cross bridges and you're not going to be able to produce tension. Beyond that, you're going to have the actin and myosin so far apart, you're not going to be able to create tension. So this looks at both of those two graphs kind of superimposed on one another. So here you have the active tension being produced. Here's passive tension. So we know at passive tension, when you get to 100% of the muscle's resting length and you continue to apply force, that's where passive tension is going to increase. With active tension, it occurs essentially basically right at resting length. Again, anything above or below that, you're either shortening the cross bridges, not allowing for increased tension, or you're lengthening it so far to where the actin and myosin are far apart. The little blue area is just a resultant of a combination of passive and active components. Now, this gets a little bit slightly more complicated when it's inside the body because of the fact that you know, we have muscles that elongate over multiple joints sometimes and things of that nature. The take-home point of it is just understanding the difference between passive and active tension and what it means as far as muscle length. When we get into kind of other factors that are sort of going to influence this, we'll make sure to mention it. Okay, when we look at moment arms, we discussed this in the previous chapter. We had mentioned how as our muscles are kind of moving our bones, okay, so our joints produce rotary motion. You have obviously a rotational force, but you have other forces at a joint as well. So obviously, again, we want primarily rotational force, but at certain points of the range of motion, you don't only have rotational forces. In other words, you have other forces that are acting based upon the position that the joint is in. You also have what are called distraction forces and compression forces. If we look at the picture over here, you see where obviously the moment arm of the bicep is pretty short because in this case, so let's say this elbow is flexed to about 20, 30 degrees, okay? So the moment arm of the tendon is very short. So it's the perpendicular distance from the joint, okay? So here, you notice what it's saying. Some of the force rotates the elbow joint while most of it actually compresses the joint. So in other words, the resultant force is you're actually getting greater forces producing compression at the joint than actual rotation. When the elbow would be at exactly 90 degrees of flexion is where all of the force would be devoted towards rotation. The reason why that would be is as the elbow flexes, the tendon's going to move further and further away from the joint. So what that means is the moment arm of the tendon is going to increase, which means all of the force then at that point will be directed towards rotation. Once the elbow exceeds 90 degrees and starts to go beyond that, then more of the forces would actually go to distracting the joint. Okay, so there'd actually be more forces pulling the joint apart than actually producing rotation. There's always going to be a rotational force. It's just going to be less or more depending upon where it's at the range of motion. With the other points of the range of motion, you'll either have greater compression or distraction forces. Now, we don't distract our joints and pull them apart, primarily because when the joints are in the range to where the distraction forces would occur, you can't contract the muscle hard enough to do it. So in other words, if the elbow is flexed to say 130 degrees and you put force behind it, you can only produce so much force because the muscle would be shortened. So while there are distraction forces, you don't actually pull the joint apart as you would commonly hear. So many times students hear, well, geez, if there's a distraction force, how come we don't just pull our joints apart when we reach that in the range of motion? It's because at that point in the range of motion, you can't produce as much force. So another variable we have to look at is speed of muscle contraction. And this gets really important when you're looking at, how much force a muscle could produce, the concepts of mechanical power, again, rehabilitation for active individuals involved in athletics, performance enhancement. These are all very important concepts to consider. So there's a decrease in force production with increasing speed based on the relationship in the myofilaments. So if we come over here and look at this graph right here, we see force, we see shortening velocity. So we're talking a concentric contraction here. So as the concentric contraction increases in speed increases. What happens to the force? The amount of force goes down. The faster a muscle moves concentrically, the less force you can produce. Okay? So think about from this perspective. If you were to throw a wiffle ball versus a baseball, which one can you throw further? Okay? So, and we're not talking about wind resistance or anything like that. Well, you can throw a baseball further. The reason being is that you're naturally, because the baseball weighs more, you're not going to move your arm as fast. What that does is it allows you to produce more force behind it than you would a wiffle ball. Okay, a wiffle ball is so light that when you go to throw it, if you try to throw it with everything you have, you're actually not putting much force behind it because your muscles are contracting so fast, there's no time for force to develop. Now, this relationship changes when we talk eccentric contraction. So now here's still your shortening contraction. So this graph is basically right here. This is isometric. There's no change in length. Here's your shortening. Notice what happens with an eccentric contraction with speed. Okay? The force goes up. So with a fast eccentric contraction, okay, with a fast eccentric contraction, you actually get increased force. Okay? So the faster eccentric contraction, you're actually able to put more force behind it. Okay? So again, when we're looking at dynamics between, like, again, if we have fast lengthening velocity with an eccentric contraction, that means you're actually producing greater force. So in a lot of times, again, with your plyometrics and jumping, you perform a fast eccentric. So that's important for that aspect of force production when you're looking at that. Okay, so concentric contraction, faster the shortening velocity, the less force you can put behind it. But with an eccentric, it can be more force. Okay, when we're talking about active tension, the amount of force produced by a muscle is produced based on two different factors. Those two factors are basically the number of motor units that you recruit and the firing rate, or how fast those motor units actually are recruited. Okay, so those are the two big factors when we're talking about active muscle tension. The number recruited and how fast they're recruited. Now, it's important to also note the order of recruitment. Smaller units are recruited first. Okay, so your smaller muscle fibers will be recruited first, then followed by the larger muscles. So as more and more tension needs to develop, you'll recruit those bigger types. Okay, so, and again, this is also going to be based upon the type and speed of contraction. Okay, and talking about age and gender and its impact on muscle strength. So males in general are generally stronger than females. Okay, both genders, muscle strength kind of increases from birth through adolescence. Usually reaches a peak at about 20 to 30 years and then gradually declines after that. Obviously, a lot of that can change based upon how active somebody is. So if someone is physically active and is strength training beyond 30 years, they can obviously not only maintain but continue to get stronger. And again, in general, males, because of physiology, greater amounts of just naturally producing anabolic hormones, males will be stronger because they will, again, in general, have more muscle mass. Now, it's interesting to note that males and females have about the same strength up until puberty. So really, when you're talking young kids, the strength differences really aren't that big, but obviously once you hit puberty, that's when, males will then start to increase their muscle strength naturally at a greater rate than females because of the fact that they're producing those anabolic hormones. Another interesting point is that when you're talking males and females, the muscle strength per cross section is actually about the same. Okay, so when you kind of just account for the cross section size, strength is about the same. However, we obviously know with the increase in muscle mass, the muscle in a male, the cross section of them will be much larger than in a female, and that's the reason why. When you do account for that, though, the muscle strength per cross section is about the same. Now, just talking about muscle mass in general, there's a lot of things that really influence the amount of muscle mass any individual has, male or female. Okay, so when we talk about things like genetic, biologic maturation, the rate at which the maturation occurs, conditioning levels, diet, what type of exercise you do, all of these things will obviously influence muscle mass. Again, we talk about age. With age, the number of motor units declines. So that means, naturally, as you age with those motor units declining, muscle will have a tendency to atrophy. So it's very important for individuals as they get older to make sure that they do strength train. And again, those are the exceptions when we're talking about things. When we talk about exceptions, you obviously always have to look at, does an individual train? What's their diet like? Certainly there are, obviously, if you look, for instance, at powerlifting numbers for females, they're obviously stronger than a lot of males because of, how they train, their diet, and everything else. So, those are obviously some of the variations we have. Again, genetics does play a role as well. Sometimes, people are, naturally more predisposed to, to have, being a larger individual and having larger muscle mass. And again, as you age, like I said, motor units are going to decrease and your muscles will atrophy. However, if you still continue to train, you still continue to resistance train into your 30s, 40s, 50s, 60s, you're not only going to maintain muscle mass, you could possibly gain more. Again, it will get harder as you'll get older to put on muscle mass naturally, but with diet and everything else, you can certainly have a much larger amount of lean tissue versus somebody who's not as active. Okay, so just looking at muscle excursion, so we look at kind of how a muscle traces along the joints and some of the function. We look at the concept of passive insufficiency. So we're going to look at passive insufficiency and we're going to look at active insufficiency. Passive insufficiency is when a muscle becomes elongated over two or more joints simultaneously. So let's take, for instance, the hamstring muscle. Okay, it's a 2-joint muscle. When you take the lower extremity with the knee in extension and flex the hip, what are you essentially doing? You're passively elongating that muscle over 2 joints. So that would create passive insufficiency from the hamstrings. Okay, the hamstring is a hip extensor and a knee flexor. So when the knee is in extension and the hip goes into flexion, you're now lengthening over it. That creates passive insufficiency. Okay, so anytime a muscle gets elongated over 2 or more joints, that's passive insufficiency. There's also the concept of tenodesis, and we see this in our hands. And this again occurs, this is a passive movement that occurs. So if you look at this picture, okay, so this person's performing active wrist extension. So if you do this yourself, okay, hold your wrist out and then just do active, do active wrist extension. What do you notice happens? So if you're doing it the right way, even though you're actively extending your wrist, what do your fingers do automatically? Okay, what you should be noticing is that your fingers, as your wrist actively extends, your fingers passively flex. Okay, and actually just the opposite will happen if you go in the other direction. Okay, as you flex your wrist, your fingers will passively extend. The reason for that, okay, we call this tenodesis, okay? So tenodesis occurs in the long finger flexors and extensors with movement of the wrist, and the reason for that is, think about it, as you extend your wrist, the long finger flexors, okay, get kind of put to the point where they create that shortening effect, okay? Again, just the opposite would happen if you were to flex your wrist, since it puts the tendons, again, on tension going over the 2 joints, they will then produce extension. Now we talk about active muscle excursion and active insufficiency. So this is when a muscle is shortened over 2 joints. So active insufficiency is when a muscle is actively shortened over 2 joints. So let's take our hamstring again. Okay, so how do we create active insufficiency at the hamstrings? Well, we know that the hamstrings perform knee flexion and hip extension. So if we flex the knee and extend the hip, we experience active insufficiency. The same would go for if we extended the hip and flex the knee. What will you notice? You'll see that the muscle strength will get decreased whichever movement you perform second. So in other words, if you actively extend your hip, and then once your hip is fully extended, try to flex your knee, you'll notice you can't flex your knee as far. It gets really weak. Same thing if you did it in the opposite fashion. If you flexed your knee and then tried extending your hip, you'd notice the same thing. The reason is because you basically create that shortening. You get the sarcomeres kind of shortened at one end, and that produces the active insufficiency. Now, our body's kind of set up for optimal sufficiency. So we don't really experience active insufficiency when we do our movements, and it's a good thing because it would basically create weakness. We call it optimal sufficiency, and what this does is it just allows the antagonist to stabilize and allow multi-joint agonists to perform the function that they need to, okay? So the antagonists help to actually stabilize, and they'll stabilize either the proximal or distal joints that they're contracting along, and will allow the muscles to produce their movements when we do functional actions. Okay, another thing we look at with the changes in mechanical leverage. So we talked about how maximum tension is produced when a muscle is at its resting length. So technically, take for instance the elbow flexors. If we were to look at the biceps brachii, if maximum muscle tension is produced when the muscle's at resting length, that would mean that maximal muscle tension would be produced when the elbow is fully extended. Now we know, so then that would what would be basically happening then as we flexed our elbow, once we got to 90 degrees and above, we would be losing tension in the muscle. Well, another way our bodies kind of limit this is through the changes in the moment arm and the tendon placement. So as the elbow flexes, what do you notice happens? When the elbow is flexed to 90 degrees, the distance between where the tendon inserts and where the joint is at its longest. So we can actually produce more force from that angle due to the fact that the leverages. So what this talks about is, yes, the length tension relationship with the muscles is important, but another thing you have to consider are the changes in mechanical leverage, okay? So we don't lose, basically, if we were at 90 degrees of elbow flexion, if our mechanical leverage didn't change with the placement of the tendon in relation to the elbow, we would lose a lot of mechanical tension, going from 90 degrees and up, which is where we really need a lot of our strength. I mean, think about it. If you're holding a weight with your elbow bent to 90 degrees, the weight's furthest from your body. You need the most amount of tension to be able to be produced. Well, we know we're not producing it from the standpoint of the length tension relationship because the muscle's not at resting length. However, because of the mechanical advantage of the tendon being further away from the elbow joint, we allow for that still to take place. Okay, looking at eccentric muscle forces, and we talked about some of the dynamics with the eccentric muscle contraction. For instance, one of the unique things about the eccentric muscle contraction is that as the velocity of the contraction increases, the amount of force also increases. That's unlike a concentric contraction. Okay. Now we know when a muscle tension matches load, you're going to have an isometric contraction, because if a muscle tension matches the load, you're not going to have any change in length. In order to lower or decelerate something, we have an eccentric contraction. So eccentric, we commonly also talk about it being negative work. So the ability to resist force increases with eccentric lowering. One of the things to note about an eccentric contraction as it relates to strength work, you can lower a heavier load than you can lift concentrically, okay? So, say you can lift, you could bench press 300 pounds because you can get the 300 pounds off of your chest. You could eccentrically lower, theoretically, let's say approximately like 360, maybe even 370 pounds, okay, with that eccentric contraction. So the eccentric contraction is a stronger contraction and can handle more weight. Eccentric contraction is also very important for decelerating. So decelerating at the end of the race, which you see here. Sometimes that's where a lot of your injuries take place. Same thing with pitching and throwing a baseball. Obviously arm strength is important to be able to create that concentric throw, but then for the health of the shoulder, you have to be able to eccentrically decelerate the arm, and there's injuries that could happen there. So part of, when, for instance, as an athletic trainer, if I'm assessing a baseball pitcher for a shoulder injury, one of the things I would ask them is when does your pain occur? Because you can actually maybe narrow down some of the structures that are causing the injury based upon when they have pain. So if they have pain when they release the ball, there's certain structures you could kind of narrow it down to a little bit more and be able to then work on that particular aspect of muscle strength. We look at energy expenditure. So again, this is what I talked about earlier, higher maximum force production with negative work. So an eccentric contraction can actually produce more force than a concentric contraction. There's fewer motor units with eccentric activity. So it's actually a much more efficient contraction. So you don't recruit as many motor units, and the reason for that is the soft tissue will actually pick up some of the force production. So less energy is expended with eccentric. Over time, it could possibly increase the more you impart on it. But in general, the eccentric contraction is a much more efficient contraction. Now, the drawback to that is the eccentric contraction is sort of what takes the responsibility for the muscle soreness that you experience. So, say for instance, you do a novel exercise, it's actually, and you wake up and you're sore the next day, or maybe you haven't exercised for a while and you go and lift weights, and particularly say with the legs, because that's usually where people experience it. There's a lot of trauma there. They get up the next day and midway through the day, they start to feel stiff and sore. The eccentric contraction is actually responsible for that, and the reason is because when you do the eccentric component, again, you're not recruiting as many motor units, and what's happening is the soft tissue is taking up more of the force, and then you're getting that little bit of micro trauma taking place to the tissue. Okay, the Crossbridge Mechanism, say a little bit about that. So we know, we've talked a little bit about in the past in other classes, the sliding filament theory. So we know that ATP, or adenosine triphosphate, is the immediate energy source for concentric contraction. So ATP is broken down and initiates the kind of, I guess, cascade, if you will, of other reactions that produces muscle shortening. Now, this mechanism is a little bit different for eccentric activity. Eccentric activity, unlike the concentric activity, is more under command of the nervous system. Okay, so the nervous system controls eccentric activity. So the sliding filament theory and what goes down with the crossbridge formation in ATP, that's what's going to occur with a concentric contraction. So a concentric contraction, while the nervous system obviously has to initiate it, there's this local chemical reaction and protein reaction that produces concentric contractions. That doesn't happen with eccentrics. Eccentrics are more of a neural phenomenon, and then the passive tissue will take up the rest. So we kind of look at elastic muscle forces. There's potential and kinetic energy. We're going to talk about the difference between potential and kinetic energy. So when a muscle is eccentrically contracting, you're creating potential energy, okay? So think lowering into a jump, okay? As you lower into a jump, you're going to create some potential energy, and then concentric energy is going to occur before it's lost. So if you watch this video here, so you notice how fast he drops. So as he drops fast into that lowering part of the jump, he's creating potential energy. If you get the concentric contraction before the energy is lost, and ideally you want to do it as fast as possible, then it gets developed into the kinetic energy, which is then the energy that's actually producing the jump and then, of course, allowing him, in this case, to jump onto the box. So the magnitude of concentric contraction is going to increase with the intensity of the pre-stretch or that eccentric contraction. Okay, so elastic muscle forces. Again, elastic muscle forces are going to be enhanced by neural factors, so that elastic property that will be demonstrated when you do certain muscle activities is enhanced by neural factors. There's the length feedback reflex. So the length feedback reflex is triggered when a muscle is stretched and occurs within the same time as the stretch reflex. So this is the reflex that kind of monitors length. Again, as the greater the pre-stretch, you tend to have a better concentric contraction. The force feedback reflex is an inhibitory neural reflex caused by muscle activity and occurs with activation of the Golgi tendon organ. So the force feedback reflex is inhibitory. So in other words, if the force feedback reflex kicks in, that's because of stimulation of the Golgi tendon organ, which is a proprioceptor located in the tendon, that basically tells the muscle to essentially shut down. And that's actually a feedback that acts as a protective mechanism. Now, it acts a little bit more than it needs to. And what we essentially do is look to do different training and exercising in order to enhance the length feedback reflex to work with the stretch reflex and produce and actually be able to produce more explosive movement. The force feedback reflex also helps in kind of coupling the anti-gravity muscles that cross different joints during sudden movement, so it also kind of helps with that as a stabilizing factor. The stretch shortening cycle, so this is what we experience with things like proprioceptive neuromuscular facilitation and plyometrics. So, the enhancement of what we're essentially looking for is a maximum concentric contraction to produce mechanical power, which again is very obviously advantageous for our sporting activity. So anytime, again, you get that sudden, fast eccentric lengthening coupled with a rapid concentric contraction, that's where you're going to be getting that stretch shortening cycle. That's classically what you see in plyometrics. You also can use this as a part of proprioceptive neuromuscular facilitation when you're doing kind of some neuromuscular training with other exercises. Okay, open and closed kinetic chain activity. So there's differences between open and closed kinetic chain activity, and they produce kind of different responses in the body. So open kinetic chain activity is typically for rapid movement. So the proximal segments produce motion for distal. So in other words, the distal segment is free to move. And whereas in closed kinetic chain, you're more concerned with force and power. And what you get with closed kinetic chain activity is compression of the joints and more muscle coactivation. So if you look at this picture, you have some examples of open chain and closed chain activity. So if we look at the soccer kick, okay, that's an open chain activity, okay, or at least the kicking leg is working in the open chain. Actually, in this case, she's open chain completely because she's not in contact with the ground at all. Same thing here, you have open chain activity, the tennis swing. Here's a closed chain activity, okay? So the feet are in contact with the ground, the body's kind of moving over the feet. So that's kind of another tip I tend to say to students when you're looking at, if I give you an exercise and say, is this an open or closed chain exercise? Is kind of the body, is the segment moving over the body, or is the body kind of moving over the segment, okay? So think about some other exercises and activities and think about whether they would be closed chain or open chain. And simply just looking at different types of resistance training exercises. Think about like things like seated knee extensions, bench press. You know, think of all those different exercises and think about whether they would be considered open chain or closed chain. Again, for instance, let's look at the bench press. Is the bench press open chain or closed chain? Think about it. So if you said open chain, you're correct. Now your hands are in contact with the barbell, but again, your hands are still free to move. This can make that easier to understand. So if you thought that it was closed chain, here's a closed chain pressing exercise, the push-up. Okay, so when you do a push-up, your hands are in contact with the ground and you're pushing your body away from the ground. Okay, so the bench press would be open chain, the push-up would be closed chain. So some factors affecting maximum isometric muscle force. So maximum force changes at different points in the in the range of motion. It's important to note that some muscles do rely on the length of their moment arm. So for instance, the book gives the example of the effect of increasing the force of the knee flexor muscles by flexing the hip to increase the stretch on the hamstrings. Okay, so in other words, as we said before, yes, when you look at muscles, yes, in theory, they should all be contracting with their greatest strength from their resting length, but that's not always going to be the case. That'll be the case with some muscles, but it won't be the case for all, because some muscles, how their moment arm will change will actually also allow them to produce more and more force. Some other factors affecting maximal isometric force contraction: exercise-induced muscle injuries. So obviously, you know, damage to the structure of the muscle, you know, in addition to the pain and everything, is going to affect its ability to contract. So once a muscle gets strained, torn, that will weaken the muscle. And also delayed onset muscle soreness. And I talked about this, I did talk about this a little bit earlier, but this is going to be caused through eccentric exercise. So eccentric exercise is responsible for delayed onset muscle soreness, which, you know, again, whether you're emphasizing eccentric contractions or not, you're always going to be doing them. So again, if you've ever felt sore after strength training, or even after running, that soreness that you get, you know, and it's delayed, you don't sometimes notice it until the next day, you know, maybe middle of the next day, what have you, and it gradually increases for a bit and then it gets better. But delayed onset muscle soreness can also cause some weakness as well in the muscles. So you always have to be careful. If you do have delayed onset muscle soreness, you should be aware of what activity you're doing on that day. And then these are your learning outcomes.